Could you explain to us just what the healthcare piece of the shutdown is right now?
Yeah, so I'm not personally affected by the shutdown, but it does affect my work because I've done quite a lot of work over the years on the health insurance marketplaces and particularly the premium tax credits that are at the center of the current shutdown. So, people who buy their coverage through the health insurance marketplaces, many of them are eligible for a tax credit that helps them pay those premiums.
Mhm.
Those tax credits were first created back in the Affordable Care Act. They were first available in 2014, but they were then expanded in 2021 as part of COVID relief legislation. And then that expansion was extended in the Inflation Reduction Act a couple of years later. The expanded credits are now scheduled to expire, which would bring the value of the credit back to what it originally was in the Affordable Care Act.
Mhm.
The consequences of that are that many people who have become eligible for these credits over the last number of years will no longer be eligible for the credit. And then many people who are already eligible for the credit will receive smaller credits. And so their out-of-pocket premiums in 2026 will be larger than they were before. And, for some people, that'll be an additional financial burden, but the sort of analysts who have looked at this conclude that it will also result in some people concluding that they can no longer afford their coverage and dropping that coverage. So the Congressional Budget Office estimate is that if these credits expire, around 4 million people will become uninsured next year and in the years thereafter, relative to if the credits were extended as they're in effect for 2025.
Hey, I'm Hannah Cole, owner of Sunlight Tax, and I help creative, self-employed people like you understand their taxes and how to do the hard stuff so you can get back to your amazing work. You can find everything you need at sunlighttax.com.